Can laparoscopy be performed in a patient with multiple previous laparotomies? Many gynecologists hesitate to perform laparoscopy in patients with a history of multiple laparotomies. The primary concern is the risk of bowel adhesion to the abdominal wall and pelvic organs. If the bowel is stuck to the abdominal wall, there's a possibility of bowel perforation when inserting the trocar. To avoid these complications, many gynecologists opt for another laparotomy instead. However, the risk of abdominal adhesions after previous caesarean section is generally low, so this should not be considered a contraindication for laparoscopy. Similarly, surgeries performed with a suprapubic transverse incision also pose a lower risk. In contrast, previous midline incisions carry a higher likelihood of bowel and omental adhesions to the abdominal wall. Even so, prior laparotomy does not necessarily rule out the possibility of laparoscopy. There are techniques to minimize the risks. One approach is to insert the Veress needle at the palmar point, located just below the left ribcage. This site is less likely to have adhesions, allowing for a safe placement of a 5mm trocar to assess the extent of the adhesions. In some cases, the adhesions may not be as severe as expected and can be managed laparoscopically. If the adhesions are too extensive and beyond laparoscopic management, conversion to laparotomy remains an option. Ultimately, the decision depends on the gynecologist's skill and experience in handling such cases. Please leave your comments.